Emma was just about to turn 4 years old when she started having a low fever that didn't go away after 5 days and complaining about shoulder pain. Parents Quinton and Yarawan took her to her pediatrician, who sent her to U of M Health Sparrow to get blood work done.
When we were first getting diagnosed is really hard to wrap your head around. It just isn't.
Heartbreaking.
Yeah, doesn't feel real. Really hard to take that and process it when you see her, even at the time, even with a mild fever, just wanting to play and being happy. So it was tough, just really out of the blue. We were told that we're very lucky. We found it earlier than normal.
Day 1 of being diagnosed with B-cell acute lymphoblastic leukemia, Emma began treatment. Oral medicines, IV medicines, some are liquids, some are pills, and some they could give her at home.
One of the really big ones that we were really happy she got to participate with is a study. It's Blini for short, but it is an IV medicine that she wears a backpack with a little pump on it, and she gets it for a 2-week period or a 4-week period twice during her treatment. And this was a medicine that's used when people have regression later on and have cancer come back. So it's a different type of treatment, and there's a couple really positive things about it.
This study was so effective that they didn't do a blind study anymore and just gave it to everyone that participated. There are hopes that in the future, this will become a normal part of treatment. This pump allows Emma to take a break from chemo and regain her appetite.
We didn't see any negative effects from it. It didn't cause any appetite differences or any behavior or anything. So we feel pretty fortunate that the timing worked out, that she was able to get the medicine.
Having been part of pediatric cancer research for almost 25 years, I can say definitively that the breakthrough of that medication was one of the biggest things that's ever happened in pediatric leukemia research. And it's really exciting that we were right here at the front of it. The study was so effective, and they found that the medication was improving outcomes so much that they stopped the study early and said everybody needs to be on this medication. So really exciting to be right on the forefront of that and to be able to offer that state-of-the-art treatment right here for our local patients so they don't have to travel for it.
Yeah, so she loves all the doctors and nurses, and they love her. There's a lot of attention, there's a lot of gifts being given. The nurses do an amazing job with her. I think they see her as one of the easier patients most of the time, where she's not necessarily fighting them on every little thing. But there's times where she's having trouble, and they're very patient with her. The doctors also, they're very good at speaking to her, kind of getting her to engage and getting her to answer questions. I think from her point of view, she just has a bunch of friends at the hospital.
It's been such a pleasure to work with Emma and Quinton and me. Families don't come any more beautiful than they are. She's such a sweetheart and such a delight, and just brings such a bubbly energy. And she's such a precocious child. So right from the get-go, it became clear that she wasn't your ordinary 4-year-old and that we were going to be talking to her in a way that's different from most preschoolers, because she does have a really high level of understanding of what's going on.
The doctors helped teach Quinton and Yarawan on how to take care for Emma at home, lessening the number of trips to the hospital and enabling Emma to have more of a normal life at home. At about 80% of the way through, she is now in the home stretch, which will involve testing and blood checks.
That this won't just keep going on, that we are getting near the end of it. It's hard not to keep worrying about it, but all the signs and everything are showing really good, and her reaction to everything has been good, so we're staying positive.
The production of this story is sponsored by Plumbers and Pipe Fitters Local 333.